I want to start this by just talking a little bit about our role at the AMA as the largest physician organization, our ability to convene groups of physicians to come together for all of medicine. I have 3 examples of areas where we've done that, and I want to talk about each one of them in detail. The first is that talking about the Medicare Sustainable Growth Rate, the SGR, what we just heard a lot about. We've obviously been very focused on that for a long period of time. So we at the AMA convened in 2010 an SGR, Physician Payment Reform Legislative Strategy Group. It was comprised of 7 state medical societies and 7 national specialty societies, and helped us develop a common strategy as physicians about eliminating the SGR. What that group did was we agreed on a 3-pronged approach. Number 1, eliminate the SGR. First and foremost, have to get rid of the SGR. Next, we have to have a secure period of stability that's statutory, not at the whim of Congress year by year. So 5 years of positive updates that can allow physician practice to have a known amount of stable time to then work on innovation and investment to enhance our delivery of care to make it more effective and more efficient. And we'll transition to this menu of viable new delivery and payment models that will allow physicians in all specialties, all practice settings, all communities to choose what works best. So what have we got done? Even though the SGR is not done, I believe there has been some unified effort in this area that has made progress. More and more members of Congress are echoing our call for full repeal. I have to say the optimist in me says that I've heard more words like elimination and permanent repeal in this town than I've heard in all the years I've been dealing with this issue. I can't overemphasize the necessity of focusing on this and the priority of it being right now. You saw a list of other things that we're interested in doing here in Washington, but the timing of where we are with the conference committee means SGR has to be the priority and our focus. I'm not saying don't talk to them about the other things, but don't let the other things dilute your focus or your emphasis on repealing the SGR now. I want to move to something else that came up in the Q&A, private contracting. We've also been working in close consultation with another group of state medical societies and national specialty societies in this area of finding a way to ease the Medicare restrictions to allow private contracting. There was a resolution in the House of Delegates in November of 2011 that called for the AMA to develop a variety of grassroots resource materials to help generate public support for the passage of the Medicare Patient Empowerment Act. As you know, this AMA-developed legislation was introduced in the House by Representative Tom Price and in the Senate by Lisa Murkowski from Arkansas. This legislation will allow Medicare patients and their physicians to enter into a private contract for healthcare services without penalty to either patients or physicians. Next, I want to switch gears to the third thing, which is electronic records and meaningful use. The regulatory issue of meaningful use and how the incentive payments will be paid, I think is another example where we came together across medicine and achieved a significant success. The AMA united with 95 state and specialty medical societies and submitted comments to Centers for Medicare and Medicaid, CMS, on the Stage 1 proposal. In July 2010, CMS issued its final rule on Stage 1 of meaningful use programs and incorporated many of the key recommendations, including reducing the number of required measures for Stage 1 from 25 to 20. We made it very clear that adequate flexibility must be built into the Meaningful Use Incentive Program to accommodate all specialists and their varying practice patterns and patient populations. We secured a delay in implementation of Stage 2 of the Meaningful Use Program until 2014. This month, CMS will be issuing a proposal for the Stage 2 of Meaningful Use Program, and we hope to again see that our jointly developed recommendations that we have submitted to them will also be adopted. The AMA will continue to join forces with state and specialty societies to ensure that physicians of all practice sizes, specialties, and geographies can take advantage of the electronic health record incentives. So again, these are 3 examples of where we as the AMA have been able to convene all of us across medicine to help all of us in medicine.